All right, hello everybody. Welcome to our next lesson here, behavior therapy and treatment. Our objectives and standards to understand how behavior therapies and treatments work and to analyze strategies and techniques used in behavior therapies and treatments. And take a moment there to read the standards if you would please. And our desired result: what help and support is provided by behavior therapies and treatments? Couple of vocabulary words here. Behavior therapy is a method to change undesirable behavior through conditioning techniques. Systematic desensitization is a technique used to help a patient overcome irrational fears and anxieties. Aversive conditioning is a technique used to link unpleasant states with unwanted behaviors in an attempt to eliminate the behavior. Contingency management is a technique that does not reinforce an undesirable behavior, but reinforces desirable behavior. And token economy, when a desirable behavior is reinforced with a useless object or points that can can be accumulated. My apologies. Can be accumulated and exchanged for various rewards. So understanding behavior therapy. The main focus of behavior therapy is on a person's behavior rather than their thoughts. Remember to yesterday's lesson about cognitive therapy and treatments focuses on their thoughts, a person's thoughts to help them get better. Behavior therapy focuses on their behavior. Behavior therapists concentrate on what is going on in the patient's life currently and steps to help them. That's in contradiction to like psychoanalysis, which looks at like, okay, maybe what happened in your life earlier or your childhood or things like that. Ultimately, the goal is to change a person's behavior. In behavior therapy, therapists believe the unwanted behavior has been learned, but the unwanted behavior can be unlearned as well. They believe that if the behavior can be changed, that thoughts can be changed. Now, in order to do this, the therapist has a variety of techniques to use. So one of these is counter-conditioning. A technique used by behavior therapists is counter-conditioning. It pairs the stimulus that triggers an unwanted behavior, such as maybe a fear of spiders, with a more desirable new behavior. And by doing this, the therapist helps the client reduce anxiety by pairing relaxation with it. And this is a three-step process. The first step is the person builds an anxiety hierarchy, kind of like an anxiety ladder, putting the most feared thing at the top, maybe touching a spider or having a spider, on their desk or on their arm or something like that, to the least feared thing at the bottom, like maybe a spider outside their window. I don't know. Comparing, trying to come up with something here. The person then learns deep muscle relaxation, so learning, just to relax and things like that. And then step 3, the person imagines or experiences each step in the hierarchy, starting with the least feared things. So if we use our example of the spider outside the window, maybe a spider in a cage, or in a jar or something like that, we tell the person to imagine that in their head, and that might be a very scary thing for them, but we teach them the relaxation techniques and the deep muscle relaxation. Thinking about that spider outside the glass will become a more relaxed situation, and gradually we work our way up to the top thing of having a spider on their arm or on their body somewhere. And eventually the patient will conquer their fear one step or one ladder rung at a time. Understanding systematic desensitization. A counter-conditioning technique that is used to help people overcome their fear of anxiety is systematic desensitization. So let's say, for our purposes right now, we're talking about a person who fears speaking in front of large groups of people. That's a very common fear for many people. If you have that or know someone who does, my mom has a fear of that as well. So it's a very real fear that a lot of people have. The patient is asked to imagine the fear while practicing relaxation to help alleviate the anxiety. Again, deep muscle relaxation and things like that. A therapist may also expose the person slowly to the fear, and this is known as flooding. An example, and I'm going to go over this triangle here. I do apologize, it's a little hard to read, but I'll go over it here with you. Let's say the person speaks in front of one person, then maybe speaks in front of a small crowd, until finally they're able to speak in front of large groups and without fear. And this one here is an example. Again, I do apologize, it's a little hard to read. So it says down here, identifying the topic for a presentation. Um, Observe someone else's presentation, which we'll talk about modeling here in a minute. Practice the presentation alone. Video record the presentation of oneself doing it. Practice the presentation with family. Practice with 2 or 3 friends. And then finally, give the final presentation in class. Okay, so this would be more of a student school, fear. But either way, you can see how we gradually work our way up to that final kind of fear. Therapists, like we just said, may also have a person watch others participate in the fear, which is known as modeling. Again, a person may watch someone else speaking in front of large crowds, or maybe their sister or brother, their mom or their dad, maybe a friend speaking in front of large crowds to help alleviate their fear. And actually, some therapists are actually now using virtual reality to help people overcome their fears so they can closely monitor the events. So let's say a person is afraid of speaking in front of large crowds. Well, maybe the therapist will give them a virtual reality scenario where they put the headset on or the goggles on, and they're standing in front of a large crowd in an auditorium or something like that. And while it's not real, it is real, and the therapist can talk them through that, and they can kind of get the sense of how that works. Control with aversive conditioning. The goal of aversive conditioning is to make certain acts unpleasant so they will be avoided. For example, alcoholics can be given medication that will make them sick when they drink alcohol. The person will then begin to learn and associate the aversive or negative feeling with alcohol and reduce their use of it. Now, this sounds great. However, unfortunately, it's about 50% success rate. So the use of aversive conditioning is a good starting point for some people, but it's not a solution. So again, good starting point, but doesn't always work out. Behavior therapy and operant conditioning. The use of operant conditioning in behavior therapy is based on the assumption that repeated behaviors are reinforced, such as if we participate in something that scares us, we do things to avoid being afraid of something. That's a repeated behavior that is reinforced in our mind now. On the other hand, behaviors that are not reinforced are extinguished. So those things that might make us not only do that behavior because we're not doing those things anymore, they go away. They're extinguished. Contingency management allows for the therapist and the patient to decide what old undesirable behaviors need to be eliminated and what new desirable behaviors should appear. And there are arrangements made for the old behavior to go unrewarded and the new behavior to be rewarded. And this can happen in a couple of ways. Items such as these are called token economies, which can be used in exchange for various rewards, such as fake money or tickets or points or whatever the case may be. Maybe when you were in school, when you were younger, maybe your teacher gave you guys stickers to put on a sticker chart. I know my teacher did that when I was in elementary school. We used to have sticker charts, and if we did a good job, like maybe we helped empty the trash can or helped a fellow classmate with something, we might get a sticker on our sticker chart. And then if you got like 10 stickers, I think you could pick a prize from the treasure chest, so to speak. Okay. And they still do this in schools today. I still see schools when I was working in other schools that teachers did this with sticker charts or other charts and things like that. So these are token economies. They're not really anything worth of value, obviously. Not a sticker is not worth of value to, but it can be combined to get something bigger. And this is used in prisons too, schools, mental institutions, army bases. Sometimes they'll give them token money, which can be used for other items. And these types of reward systems help people become better in their lives. So closure. What help and support is provided by behavior therapies and treatments? Think about operant conditioning, aversive control, all those different things we talked about, counter conditioning. Think about all those things, and that'll help you answer your question here. I hope you have a great rest of your day or night. Make sure you respond to the video question as well that you'll see below here, and have a great rest of your day. Talk to you soon.